Hi, my name is Kayla Graves, and we're going to go ahead and do a direct fecal smear today. I have my slide out here. I have a cotton-tipped applicator that I'm going to use to help put the fecal material into the slide with. I have my saline, as well as my cover slips here, and then my microscope's just right behind me. What I'm going to go ahead and do is place just a few drops of saline onto my slide, and then I'm just going to dip my fecal material here into this, or my applicator into the fecal material. I don't want to get a whole lot, but I'm going to get enough to kind of smush it on there. That was a little much. Take some off. There we go. Alright, so I'm just going to kind of smush this around into the saline. And you don't want to have any large pieces of material on here. You just kind of want it all to be mixed up into the saline. Add just a little bit more. You don't want it to be too dry, but you don't want the whole slide really wet either. I'm just going to kind of mix this up, and I have my... The nice thing about the cotton tip is that I can kind of pick up some of these larger pieces. So it works really well on mixing this up. I really like using the cotton tip swab just for all that. Alright, so I'm going to place that back in my fecal bag. Now I have my cover slip right here, and I'm just going to grab that and apply that on top. And then we'll go ahead and take a look at it underneath the microscope. So I'm just going to bring this over here. Alright, so I'm first going to go ahead and look at the slide under 10, and then I'll switch the power up to 40. Okay, so I have my fecal slide here on the microscope. We're going to go ahead and look at see if we find any parasites. I'm going to start out with 10 power on here, and then I'll go to 40. And we're going to go ahead and look over the entire slide this way. So this is on an older dog that is dewormed monthly. That's on IRR, so I don't plan on seeing much on here. So I usually start at the corner, the left corner towards me, and then I will work away from me. And I'm just going to kind of look over the slide, see if I see anything suspicious. If I do, then I can up the zoom to 40, which will kind of help me to diagnose what it is. Alright, I'm going to kind of zoom it into 40 really quick. See if I see anything. Don't I see much there. I'm gonna back out. And I usually look at the slide going towards me and away from me. And then after I get done, I will go back over and do the opposite direction just to make certain that I don't miss anything, because some of these guys, if they have a very mild infection, then you might only see 1 or 2 parasites on the whole entire slide, so you want to make certain that you don't miss anything. Alright, so I'm going to go back over one more time in the opposite direction. Alright, so I don't see anything here on the slide, so I'm going to go ahead and go right down on the chart that the fecal sample was negative, no parasites were seen, no ova was found on our float. So that way we can go ahead and let the owners know that the dewormer is doing its job, it looks like.